Well, my story is actually very, very personal. It happened when I was delivering my second child, Victoria. They knew that when I delivered my first son, Matthew, that I'd had some trouble with bleeding out. And so they made sure they had all the precautionary there. They told me what was going to happen, and just in case that happened again, they would be able to stop it a lot faster than they did before with Matthew. But unfortunately, that didn't happen. They couldn't stop the bleeding. My husband was rubbing my arm. He was rubbing my arm, and he said, "You're going to be okay. You're going to be fine." And the last thing I remember was pulling him down to me and saying, "I'm not going to be fine. I'm dying, and you need to take really good care of the kids." I literally felt myself leave my body. I felt myself turn around and look at myself laying there on the table. I could see my husband holding my hand. I could see the nurse standing at the door hollering stuff out for the doctors and people to do stuff out there. I left the room and I saw my sister on the phone in the lobby. I did see the light, and I went towards the light. It was at the corner of the room, and I turned and I went towards the light, and I went walked down this long hall. There were these two male figures that were in this back of this hall that I was trying to get to. And one of them saw me first. He was huge, very, very tall. And he turned around and looked at me and said, "What are you doing here?" And the other guy turned around and looked at me and said, "It's not your time right now. Go back." And immediately I went back. I heard the beepings going on. I heard all that stuff happening. And I knew that that I had just basically knocked on the doors of heaven and returned. The next day when I was in postpartum and I went back to go get her, they hadn't brought her to me yet. So I thought I would just walk down to the nurse's station and then go to the NICU and go get Victoria. I said, "Can I have my daughter so I can try to breastfeed her now?" And I pointed to Victoria, and they said, "Oh no, honey, that's not your daughter. Her mom almost died last night, and we brought her back. That's not your child." I said, "Look at my wrist and look at her foot. They match. That is my daughter." And there were three nurses in there. They said, "We heard stories about you last night. There's no way that you're up, and there's no way that you're walking by yourself." That they did not think that I would be around especially not walking. And I actually went home that afternoon. So total miracle. It impacted my relationships on several different areas. First of all, I feel like I'm here for a reason. I feel like I'm here to definitely raise my children. I very much live in the moment of everything I do. I definitely live in the moment and feel like we all should. I was a Christian to begin with. When I told you I saw my sister out on the phone, what I found out later is my sister was actually calling my mom. She called the church that my mom goes to. And they stopped service and prayed for me during service. And so I truly believe it was a miracle from God that brought me back. You don't hear about a lot of deaths in childbirth anymore, but it still does happen. And that it just happened in my small town that I grew up in, and then it was happening to me. So they literally stopped the service, prayed for me, and I don't question God anymore. I've seen a lot of other miracles in my life, but to me, there is no doubt that there is a God, that there is a heaven, and that He cares for each and every one of us. My outlook on death, I've never really been afraid of dying, but after that, it was such a peaceful experience. I'd read in the Bible that there's no tears in heaven, and you hear songs like that. And it was very, very peaceful. Even though I was leaving everything that I loved and cherished, I wasn't sad. It was just very, very peaceful. So I'm not afraid of dying. I don't go looking to die. I don't go jumping off buildings or anything like that. But I'm certainly not afraid to die at all.
I had a lady that came into me that was, I'm guessing she was late 30s. She arrived. She was sort of pale and diaphoretic sweating and complaining of an irregular heartbeat and palpitations and some chest discomfort. She complained more about pain and then became nauseated, and I thought she was going to actually throw up, but instead she actually went into ventricular fibrillation and went completely out. I ended up defibrillating her. She didn't come back immediately. She was out for several minutes, and I think at one point she actually was in asystole, where there was no heartbeat or any heart activity at all electrically. she ended up in a course V-fib again, and I shocked her, and she, after a couple of shocks, she actually was resuscitated. I guess that all went on for about 5 or 10 minutes. I didn't really see or hear from her till about a year later. I was in a very small town at that time, and I was walking this was a strip shopping center, and I was walking down. This lady approached me and said, "Do you remember me?" And I kind of looked at her at first and didn't quite get it, and then it finally dawned on me who she was. And she says, "Well, I just want to thank you." And so I said, do you remember anything about it? And she said, "Well, I remember coming to the hospital." And she said, "I don't remember a whole lot after that until I remember seeing you, being above you, and seeing you and the nurse and some other staff from the hospital in the room with me, resuscitating me." She apparently saw me doing everything that we were doing to her. With time, she said that her attention was drawn off to a light above her and around her, and she turned and was focused on that light. And she said she had an incredible feeling of calm, and started moving towards the light. And the closer she got to this very intense light, white light, is how she described it, the calmer she felt. She felt a sense of others around her, but she didn't see anybody at that point. She heard this, it's not your time, you have to go back type message. And the next thing she knew, she was waking up in Danville in the intensive care unit. So that was my first good description of somebody that had actually been clinically deceased for at least 5 minutes or longer, that I actually got to interview that got resuscitated. I've talked to probably three other individuals, as I recall. All of them experienced this sort of intense bright light in some way, and a lot of calm. They talk about how a sense of well-being and total peace and calmness. I don't know how to describe that. They really had trouble describing it to me. A couple of them saw family members that had passed before them. I know that at least in one case they said that they were told by one of those family members, "It's not your time yet, and you have to go back." I do know of one situation, and it wasn't my patient, it was one of my partner's patients that he resuscitated, that came back and said that he never wanted to go through. He was so thankful that he had been resuscitated, because he never wanted to go through that again, because he wouldn't even describe it to me. So it was the most terrifying experience he's ever had. During the period he saw people working on him, and he felt being dragged away from that place, and he said it was just the most terrifying thing he ever experienced. And he really either wouldn't or couldn't describe exactly what was happening to him, but it was a totally different experience than the four people that I talked to.
My husband and I were in Napa Valley on a wine tasting vacation, and I had a horrible earache and headache. I saw 4 different doctors in emergency rooms, and I was told, "Oh, no, you just have an earache, it's just barotrauma, don't worry about it." And on the 5th day of our trip, I could not get up off the hotel floor, and I had a very, very high fever, and I had to be transported from the resort to Our Lady of the Valley Hospital, and I was being transported from the ambulance bay into the ER, and I think my fever was probably 104, 105, and I was very septic. I had a bizarre beta strep infection, just like strep throat, that had eaten through my vestibular network in your ear and caused a brain abscess. But I had gotten so septic that all of my systems had shut down. And actually, I worked in an emergency room, flew on a trauma helicopter. And when people tell you when they're really sick or when they're dying or in hospice and the last of their senses to go is their hearing, it really is, because you can hear things when you have very minimal vital signs. And the last thing that I remember is truly, I mean, it's just like a made-for-TV movie almost, being lifted off of the stretcher and watching things happen to me from above. And a very, very warm, well, yeah, the whole time you're in a hospital, it's always cold, but the room got really, really warm. And as a nurse, to have it happen to me, it was very bizarre. And I believe in God. And, of course you start bargaining and praying. And I'm a mom. And I can remember asking, are you sure? You can't, it's not my turn. It's not my turn, God. It's not my turn. It was just the most beautiful colors of angels. And if at Christmas, when we see lights and we see wings and we see angels and the things that we think of when we are told of the birth of Christ, and you think of all the riches and the wise men and just the glory of God, the circle of angels stood around that bed with those nurses and doctors, and what the voice said was, okay, not now, but you have a job, Laura. And as a nurse, I always worked in faith-based hospitals because I really believe that your faith and prayer and healing have to go alongside what medicine can offer. And I have not worked as a nurse since. My own health has dramatically been impacted. Spent 2 weeks in ICU at Our Lady of the Valley. I got to fly home to Atlanta to have brain surgery. I had to have brain surgery twice to evacuate the infection. But you don't get an infection like that just because it's Tuesday. And I was diagnosed with lupus, and systemic lupus really does wipe out your immune system. And I've also been treated for cancer 3 times, and it took 2 brain surgeries, 2.5 years of IV antibiotics to get rid of that infection. I've had some interesting twists and turns to become the patient and not the caregiver. I really do believe that this incident changed me for, obviously, for good. I don't get to do hands-on nursing anymore, but I think that my life is definitely different. I am far more forgiving, far more accepting, much more willing to extend grace than I ever was before. Willing to give anybody another chance, and generous to a fault, and that's a dangerous thing, but it's actually an honor for God to entrust me to be given these challenges, to be given these, these opportunities to say, okay, I get it. So it's actually quite a privilege to get to be the patient instead of the nurse.